Osteoid osteoma, as the name depicts, is a lesion which has immature osteoid formation and a nidus formation along with a lytic lesion. The osteoid osteoma happens in early 2 to 3 decades. It can happen in the metaphysis as well as in the posterior element of the spine. The primary hallmark of this lesion is that the patient is with complaint of pain because of the prostacyclin secreted by the lesion. Interestingly, the pain is increased with alcohol intake and reduced with taking aspirin. There is nocturnal pain agitation. There is no signs of constitutional symptoms itself. It can present as a spinal deformity with with the osteoid osteoma towards the concavity side. For assessment of the patient, a radiograph is indicated to check the findings. A CT scan is a gold standard with respect to investigation and identification of the nidus. In cases where CT scan, if the nidus is not identified, another option is to do MRI in early stages. A bone scan will tell you the double density sign, which shows high density in the center while low density in the periphery. The treatment of this is excision of the nidus itself, which can be surgically done, or radiofrequency ablation. In radiofrequency ablation, basically a cannula is placed CT guided at the reach of the at the level of nidus. Bone is penetrated via K-wire first to reach the nidus. The K-wire is then replaced by a radiofrequency probe, which is heated up to 9 degrees centigrade for 5 to 6 minutes. After this, the patient is followed up after 30 days with a follow-up MRI. The radiofrequency ablation is quite also effective in spine osteoid osteoma. If the lesion is more than 2 centimeters, sometimes it is called osteoblastoma. It has slightly differences than the osteoid osteoma itself. It shows as a lytic lesion instead of a sclerotic lesion, and there is some mineralization within the lesion. It happens in metaphysis and showed up as hot bone scan. Treatment is almost similar to the guidelines with curettage and bone grafting, radiofrequency ablation, and in-block excision.